Hello, is this thing on?
Do you think they can hear us?
Nah, let's say it again. Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amie,
And my name is Sara.
and we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, Google, iHeartRadio, Amazon, or any other podcast listening platform, don't forget to subscribe so you can get updates to when we have our latest episodes. Also, don't forget to rate and review us.
And if you like what you're hearing and you love our advocacy work, don't forget to go to www.grittynurse.com and click on the donate button.
As little as $1 or $2 a month for a total of $12 a year will help us with our monthly podcast costs, such as website hosting, our hosting platform,
audio equipment, and the time and energy it takes us to put out good quality episodes. We thank you and we appreciate you. I think this is probably most people's worst nightmare, right? And especially for patients and family members and those listening who are not necessarily a part of the healthcare world in terms of giving care. So, being a nurse, physician, we have a different perspective on how we view care. But I'm kind of talking about it from the angle of, our family members, other people that may be entering and accessing care who don't really understand the system. And I think this is always like the worst case scenario of feeling like you're not getting the care that you're needing. And then on the other hand, it being so poor that the experience actually results in death.
Yeah, and I think a lot of it is just due to unfair stereotypes and bias, things that really don't, they shouldn't have an impact on the type of care that you receive, but unfortunately they do. And when we're talking about things like this, it's not just racism, but also mental health, different conditions that you may have that, people are judging you for having these conditions. And really, it just needs to be equal care for all. And that's kind of what we're talking about here and what we're advocating for.
Yeah, I mean, I hope that at the end of the episode, we can give you some pearls or even just, our few words of wisdom in terms of bias. And yes, it is about systemic racism and a variety of other factors, stigmatization, marginalization. But how do we as healthcare workers prevent it from happening? And then two, what can you as, a patient or a family member coming in, how do you advocate for your loved one when you feel that there is an inequity that's actually occurring in terms of healthcare, or you don't feel that your concerns are being taken as seriously, what steps that you might be able to take. So this episode is going to be a little bit different. We decided to take stories from various news clippings, and really, I think this is actually just like the tip of the iceberg. These are the ones and the cases that you actually hear about, but I feel that under the surface, there's probably a lot more that goes unreported, and I think that's the scariest part of this whole type of situation.
Yeah, and we kind of wanted to focus on groups that are marginalized and particularly vulnerable in society because they're the ones that really need the most help, and they are usually the ones that have the least amount of voice. And
Yeah.
we want to continue giving voice to people that don't have one, and for their stories to be heard, and for people to understand some of the learnings that can come out of them.
Yeah, absolutely.
Okay, so I want to talk about a case that I actually read about a number of years ago, but it still
Hmm.
kind of resonates with me a lot. And this was a gentleman by the name of Brian Sinclair. He was an Indigenous Canadian man who actually, initially, he went to the hospital because he had a blocked urinary catheter. So he hadn't been able to urinate for 24 hours. He went to a community health clinic who determined that it was blocked and referred him to the local emergency room in Winnipeg. And so he arrived to the emergency room via taxi with a note from the community care clinic, I guess, explaining his condition and why he was there. So he spoke to a triage aide who instructed him to wait in the waiting room. And this aide wrote something on a piece of paper. It might have been just some cheat notes or whatever to pass on to the nurse. And then this gentleman wheeled himself into the waiting room. So this occurred at approximately 3 p.m. And during the evening, so during shift change, it appears that the triage list was discarded. So if his name was written down anywhere, it was no longer there. And then at 1 a.m., it looks like somebody talked to him and he indicated he'd been waiting for 10 hours.
Wow.
And yeah, and then while he was waiting, he also vomited several times.
Oh my
So
god.
between that evening and the early morning, he passed away in the waiting room. And so, okay, so we're talking about, so September 19th was the day that he got there. All day September 20th, he was waiting, and at some point he passed away. And then on September 21st at 1 a.m., a nurse was finally requested to check on him. The nurse didn't believe the request was urgent and instead completed paperwork.
Wow.
So shortly after that, another nurse kind of approached a security guard and thought that he looked dead because his neck was quote unquote pasty and his catheter was empty. And then the security guard went to the gentleman, pinched his neck, and received no response from him. The security guard contacted medical staff, informing them that he believed that he had died. And the staff first thought it was a joke. I don't know why they thought it was a
That's
joke.
pretty disgusting.
They then moved him to a resuscitation room where he was immediately declared deceased. And an autopsy later found that Brian Sinclair had a treatable bladder infection brought on by a blocked catheter and had been deceased for 2 to 7 hours before he was noticed by medical staff.
I have no words.
I know, and then I'm actually upset reading this. And then it goes on to say that Brian Sinclair had been observed at least on 17 occasions. There was a chance that somebody could have, checked on him, assessed him, but he was ignored. And the other thing is that they assumed that because he came into the waiting room and because he was of indigenous descent, that he was assumed to be intoxicated, and that's why he was sleeping in his wheelchair. Or
Wow.
they assumed that he had been discharged and had nowhere to go, or that he was homeless and was seeking shelter from the cold weather. He was also a double amputee and had a history of substance abuse. So I think for him, the cards were really stacked against him. And this is really embarrassing that it happened in Canada and that it happened not that long ago in 2008.
Yeah. And I mean, I think even just thinking back to like, even your statement, kind of like the cards were stacked against him. It's kind of like, we shouldn't be in a situation in healthcare where there are certain factors that may be taken into account and you are treated like less or not like a human, really, because that's kind of how they treated him. Like they didn't treat him with respect and dignity. Like how could we have guidelines? And here's where I would say let's do kind of like our like in the moment. So like what are some of the things that I know? So in the emergency department there are guidelines that they actually have to follow for the amount of times that a patient has to be assessed. And this is actually something called the CTAS emergency triaging system. So it's the Canadian Triaging Acuity Scale. And this essentially looks at there are various different factors that patients can be identified under, one as being highest of priority and five being lower priority. But even within these guidelines, they give you reasonable amounts of time frames in which a patient should be assessed. And assessed means like there's actually work that has to be done. Like the patient, you need to lay eyes on the patient, you need to do your vital signs, you need to do whatever assessments are deemed necessary based on the patient's presenting complaint. So that's kind of like first and foremost. So the fact that this patient could have sat in the ED for so many hours without being even looked at is really, really fucked up.
Well, and I have to say too, I mean, we're talking about being assessed by a qualified medical professional, not just,
Hmm.
somebody that's saying, "Hey, how are you?" That's not really what we're talking about. We need actual medical care being provided to this patient. And as I'm reading this story, I can't help but feel probably how disempowered he was in the hospital, because some people listening might be wondering, why didn't he speak up? Why didn't he demand to be seen? Well, I think when you have sort of like a background that he had and you've always been silenced, you've never been listened to, he probably didn't feel that it would have been of any value to kind of advocate for himself, or maybe he did, and that didn't make it into the news story. So I think about that sort of thing as well, like how have you been treated historically by the healthcare system kind of determines your experience with it. And
Yeah.
we know that indigenous populations, they feel that they've had a violent history with the medical healthcare profession, and really they avoid going there if they don't have to go there. And I don't blame them for that.
No, I don't either. And I think that, when you think about someone who's entering the emergency department or entering the hospital seeking care, they're already in such a vulnerable position, right? Like you're already sick. Why is it that you have to feel that one, you have to, maybe advocate for yourself or, bring more light to your situation. That's the whole point of you being in the hospital in the first place. You're going there to seek care and to seek help. And it's just, we can't allow these systemic issues to continue to blind nurses, physicians, and allied health members to treat people in this way. Like we have to do something, and we have to keep talking about it, because if we don't talk about it, we won't see change. And it's it is heartbreaking and is absolutely disgusting to hear this situation. And actually, I remember hearing about it and being like what, how did this happen? How did it come to a situation where someone sat in a chair to the point where essentially he had rigor mortis and they didn't check on him?
And the full time that he was there was 36 hours. So we're not even talking about a day and a half. Like this was like a full 24 hours plus another 12 hours.
I have no words. Like, it is absolutely abhorrent that a human being was treated that way. And I know that's not the training that nurses or physicians or other people in the healthcare have, but we have to understand that there are racial biases, and we have to make sure that we have systems that stop that perpetuation. Otherwise, we continue to see this happening. And it's kind of surprising, even out of the cases that we've pulled, it was pretty random. 3 out of the 4 cases that we pulled are indigenous people. I think that
Hmm.
says a lot. And I mean, I think, like I said, I think we're only scratching at the surface. I'm sure people listening could probably throw us hundreds and hundreds of stories of their own experience where it has been a very poor one, and they feel that it's based on their socioeconomic status, their heritage, their culture, their history of mental health. Like we've got to do something different.
Hmm. So, just as a follow up to this, they did say that in 2014, a report concluded that his death was preventable and put forward 63 recommendations to overhaul the front end of Winnipeg's healthcare services, including how patients in emergency rooms are triaged and registered.
We know that much hasn't changed, because that is probably, I think, the oldest case that we pulled, and there are several more that have happened since then.
Hmm.
Let me jump into mine. And mine is a pretty recent case. And this is, I'm pretty sure most people have actually heard of this case. And it's the case of John River. So he's a Toronto area rapper. And his actual name is Matthew John Derek Huey. I hope I pronounced his last name right. Essentially, when this gentleman had gone to the doctor with chest pain and shortness of breath in 2017, he didn't really know that he was going to embark on like a whole 2-year medical journey nightmare. And he actually visited the emergency department several times before any physicians actually took him seriously. And it was only on his 5th visit that they actually gave him a spinal tap to test for meningitis. And then for the next 60 days, he visited family doctors, specialized clinics, and emergency rooms as often as 30 times to search for an answer. No one was able to help him or give him or provide him with any guidance or answers. Some doctors said to him, you're just suffering anxiety, depression, and prescribed him antidepressants. And he's like, yeah, this is not what the situation was. And and that part of the story really gets to me too. If you're kind of saying to someone, hey, like there is something physically wrong. I feel like there's something physically wrong. Don't tell me it's in my mind.
That is so insulting. It makes me angry because it's happened to me before too. And I'm just feeling the anger bubble up. Like, these people are obviously, they're not making it up. And I think there's something in healthcare where they're like, if you are a person of color and you say you're in pain, you are treated so much more differently than a person like a white person that says they're in pain. They get much more attention, they get much more treatment.
You don't want them to get addicted to pain meds, right? Oh my gosh, that is like the worst excuse I've ever heard. And we know that like black pain in general is severely undertreated. And it's like all built into the history of medicine. Let me continue going on with this case. So it really wasn't until his family and himself actually took to social media that they were able to find a doctor who would actually look into his case. So the doctor soon discovered that River's brain was sagging in his skull due to low cerebrospinal fluid levels. The doctor believed that River's spinal canal had been leaking since he had meningitis, since he had the meningitis test 2 months prior. And the cerebrospinal leaks are common known complication of spinal tap procedures. It is a difficult diagnosis, but that's why you actually do your work. You do your history. You look through the chart and you say, okay, what has happened with this patient? What might actually be happening? And you look for those types of diagnostic criteria and you do the test that you're supposed to do, right? I mean, I think to me that would have been a red flag to say, hey, this, like, for example, we have our pregnant moms that might come in, have a delivery, have an epidural, and for whatever reason, if the dura is punctured, they might actually have a spinal headache. So we have to come back. They might have to come back in to actually essentially like refill that space. We know that's something that's common. If they know that this is a common finding that can happen with someone who has a spinal tap, then why would it have been something that they've investigated?
Right, and I just remember you saying that he had sought care 30 times, and I'm just thinking, as he's getting higher and higher in the numbers, that someone might have thought to refer him to a specialist or think about differential diagnosis. Like, don't send him back home and tell him to do the same thing that he's already been told to do. That's not solving the issue. So I can't help but think that he went to so many different doctors and hospitals and was, repeatedly told the same thing. And it's just so frustrating that he lost so much time of his life. And the fact that he's well connected, he's like a celebrity, and it took him this long to get the help he needed is it's kind of sad.
Well, it kind of just goes to show that it actually doesn't matter. Like when you throw in race, unfortunately, it doesn't matter. Like, I mean, we can go back and we could talk about Susan Moore in the States. It's like she was a physician and it didn't matter. Anyhow, River required 8 months of recovery and also wonders why no one listened to his pleas for help. He said, I absolutely, unequivocally, no doubt feel that it was absolutely had to do with the fact that I was a young black man. He also adds that he felt multiple instances of racism as he dealt with healthcare providers, including one visit when a nurse accused him of visiting the hospital solely for drugs. She said to me, I know you're here for drugs. Why don't you just tell us which drugs they are and we'll expedite the process? He said. How was it within a 2-minute time period that you were able to come up with a distinction that I either came to your hospital to abuse narcotics or to sell narcotics? What the hell, Sarah?
You can't make this stuff up. I'm sorry. Like, I just don't even know what to
Could
say.
you imagine if, you're sick and you know you're sick and like someone says that to you, you're just drug seeking.
Like, I don't think people can understand until it happens to them, like how that actually makes you feel as a person.
But how do people like how did this nurse think it was actually acceptable to say something like that? To be like, just tell me what drugs you want so we could just speed this up. What?
Right.
Like I know you didn't learn that in nursing school. What right do you think you had to actually say that to anybody? Even if you thought it, that the thought's still disgusting in itself. But the fact that you said it, like, geez, should you be a nurse? Like, is this profession the right one for you? Maybe you should actually think about your job. I think this is a valid question to put out there. If you are having these conversations or these thoughts with your patients that come into your emergency departments, your units, and you feel it's okay to say things like this, maybe healthcare is not where you should be. No, I actually let me backtrack. Healthcare is not where you should be. If you are a racist individual, or you feel that it's okay to stigmatize or marginalize people further for seeking care, then you should not be working in the healthcare industry because you will only cause more harm. I just want to kind of quickly round to some of the concluding things that had happened. So, in 2018, the Canadian Public Health Association acknowledged that we are all either overly inadvertently racist, and that the influence of this racism affects the health of individuals and populations. And she offered several recommendations for all levels of government and healthcare providers, including a complete review of policies and to provide a system wide anti racism, anti oppression training for all staff and volunteer. Kathleen Finlay, the CEO and founder of the Center for Patient Protection, called Rivers treatment appalling. Anytime a person presents multiple times to a hospital or healthcare provider for the same symptoms or worsening of their symptoms, that should send up big red flags. That is something that should not be happening. Fortunately, in this case, the outcome worked out well because he actually did not succumb to his illness. And there are people that actually could have died in this type of situation. So the Ontario Ministry of Health declined to comment about Rivers' case. Surprise, surprise. But they said in a statement that the government is committed to providing all people in Ontario a healthcare system that is focused on them, which is so vague.
Hmm.
Why couldn't they call out the fact that maybe there's systemic racism? Why didn't they call out the fact that, like, it's like sometimes healthcare officials and lawmakers are afraid to say racism.
I think that statement sounds like it was written by a lawyer. That's what I think. It's very kind of a blanket statement.
But it's like, why can't you just say it's racist? It's just it's racist. It's not a
Mhm.
hard thing to just.
Just say it for what it is. You don't have to
It
sugarcoat it.
rolls off my tongue very easily. It's racist. And I don't know why people are so afraid to say it. I just wanted to add that the ministry also added that it does not collect data on patients' race, and that but that could be used to measure access to treatment. So that's a whole other podcast episode as to why does the ministry not collect race-based data?
I think that, I mean, in the States they do, right? Like, this
Oh
is
yeah,
probably a good question to ask, but I believe they do track it quite closely.
not here.
But we should, because we're the
Mhm.
multicultural country.
And how else can we show people that there are disparities? I mean, the stories are one thing, but maybe the numbers are so appalling that they don't want to collect them. But we'll push for it because we need to see race based data and related to health disparities and health outcomes.
Okay, so I'm going to talk about a story that is also pretty recent, and people might have heard of it because it wasn't too long ago. So basically, there was a man that presented to the emergency department, and he was having excruciating leg pain. He, explained to the nurse what was happening, and they basically didn't believe what he was saying because they did a health history and he disclosed that he was bipolar and that, he had this condition. He was on medication for it, I believe. They basically wouldn't do anything for him. And he was in so much pain that he literally had to crawl out of the hospital. There's a video that I just watched. He's on all fours, crawling out of the hospital, and there appears to be a healthcare worker that's walking along beside him and talking with him. And you can see people kind of going to and from, they're going in and out of the hospital. They're like looking at him to make sure he's okay. But, nobody actually stopped. And the person that was escorting him out actually walked along beside him while he was crawling on his hands and knees till he was out of the hospital. And then a security guard actually helped him get a taxi so he could go home. And then it turns out that he ended up waiting several days and then going to see his psychiatrist, who determined that his leg pain actually had nothing to do with his mental health issues, and sent him back to the hospital. I believe it was a different hospital where they
Right.
determined that he actually had, and I might say this wrong, Guillain-Barre disease, which is potentially fatal. So he could have died because his symptoms were ignored, and they didn't assess him properly. And once they heard the word mental health illness, I think they just assumed or wrongly determined that he was there, and he was making up his pain, and that his pain did not need to be addressed.
This is where the other piece comes in, right? So we've talked about the racial disparities and the systemic racism that is pervasive in healthcare, but we haven't really touched on the mental health aspect. But we know that, again, when it comes to mental health, people are treated differently as well. And that stigmatization, again, really causes those types of issues. And the fact that they played it off like, oh, he doesn't actually have leg pain, it's just his bipolar, is again like, why are we doing this to people? Why are I thought one of the first things I remember learning is pain is what the patient says it is.
Yes, exactly. I remember that as well.
Why are we denying people what there's like, why are we being so distrustful? And I understand, like, I know people will go, oh, you know what, there are people that are abusing narcotics, and there are people that are, that just are out to get drugs, and it's like, okay, well, they have a problem. Can we still stop stigmatizing the fact that people are you that if you're utilizing cocaine or you're utilizing opioids, it's because you have a problem that you need help for.
Right. And just because you have mental health issues does not mean you don't feel pain. Just because you're Black,
Right.
Indigenous, Asian, does that mean you don't feel pain? Does that mean you deserve to be in pain? Because I feel like that's inhumane. Does that
It
mean
is.
that you should be not taken seriously, be told that you're lying, be told that just man up and you'll be fine? Like that just goes against what we are supposed to be doing as healthcare providers.
it
And
it just boggles my mind.
so the story doesn't end here, and actually I was
Oh
quite
no.
shocked by what happened. So I mean, this gentleman, his name is David Pontone. So David Pontone's family actually went to the hospital and was once they actually realized there was footage of him crawling out of the hospital, like, they demanded to see it. And then the hospital came back to them and said they could only release the photo if they blurred all the faces in the video except for his face. And then they went on to say that even if they blurred it, there was no guarantee that he wouldn't take the video and unblur it. And they tried to make him pay for some IT person to professionally blur all the photos or all
Are
the
you
other people
kidding
in the
me?
video, because they thought that he might unblur them and release that information out into the public.
Let's talk about this a little bit here. Okay, so what rights do you have to your personal health record, or these informations? You have every right. They're yours. Like, I mean, I think that's the other thing that most people don't
Absolutely.
understand. You have rights and access to all of your medical treatment, whether that's notes, documentation, everything. Like, anything you want, you can request, and they have, within reason, they have to give it to you.
All you have to do is contact hospital health records, and they have to produce your file. It might not be right then and there, but you make the
Right.
request, and then they do what they need to do, and they need to give you that file. So it might be several days or whatnot, but you do have a right to see your own medical records. This is your right.
You have the right to complain, right? You have the right to reach out to whomever it is that you feel, whether it's the CEO of the hospital or patient relations. You have the right to make those calls to say, hey, I feel like something untoward happened here. And the other thing that people don't realize that they have the right to is they have the right to ask for a review. They have
Absolutely.
the right to say, I actually want this reviewed at a higher level, and I want to know what the outcome of this situation is. Because sadly, I've had to do it for my family members, because on more than one occasion, my mother and my aunt has suffered at the hands of the healthcare system, and it's only the fact that I know how to navigate it a little bit more than the average person, that I know it's okay to ask for these things and to demand that there's something done completely differently. I remember actually going in for it was an MRI of my knee at the ex undisclosed hospital. And it was during COVID times. And I remember saying to Jordan actually had come with me. And I remember saying to him, like, I have no idea if they're going to let you in, whatever the case may be. And we both got to screening, and this is the other thing. So a lot of people don't really like they'll look at me and Jordan, and they might just not assume that we're together. So I would say, or he would probably like me to say that he's white passing. So his mother is Grenadian and his dad is British, but he just looks like a white dude, right?
Hmm.
Anyhow,
Yeah.
anyhow, we were walking into the ED department. They asked me all my screening questions, and I was like, "All right, let's go." And they're like, "Excuse me, your friend can't come with you."
Your
And I was like,
friend?
I beg your pardon." And like, "He can't come with you. He needs to wait out. Like, he needs to wait outside the hospital." And I was like, "Okay." I'm like, "Jordan, don't worry about it. It's COVID times. I'm not gonna get into any drama with anybody. Just go." So he goes back out to his car. I'm walking down. I get to the MRI place and I see two people there. And I'm like, "Oh, okay." There's like more people waiting for MRIs. And the guy is sitting down, and the woman is up at the like station. And I sat down and I was just kind of like, okay, well, let me preface it with there are two Caucasian people. And I just said, "Hey, how long have you been waiting?" Because there was like no attendant at the window. And he's like, "Oh, I'm here with my wife, and we've been waiting for 15 minutes. Hopefully someone comes to the window." And I just turned, I was like, "I beg your pardon?" He's like, "Oh, I'm here with my wife." And I said, "So you're not actually getting an MRI done?" And he's like, "No, I'm here with her." And I was like, "Oh, really?" So I just sat back and I snapped a picture, and I was like, "This is what the problem is. Why is me as a racialized woman couldn't come in with my partner to the ED?
And he's not
What
even
if
racialized. Like, what if you and him were racialized? Like, I just can't. Keep
well,
going.
it just begs the question, right? To be like, "Well, what exactly is going on here?"
Like, I can't help but think it's like obviously not a coincidence that this happened to you and it didn't happen to the other couple.
Well, this is what, like, I had to take a picture. And then of course I did say I said to the hospital, I said, "Hey, this is what's happening. Here's proof." And they were like, "Oh, I'm so sorry. I can't believe that that's happening." I'm like, "Well, you guys need to talk to your screeners and not make them be racist." Like, that's that like how else do you explain that? I didn't, as a racialized woman, I went in and had to be by myself, and I can only imagine how many times this actually occurs, Maybe my mom is too loud, or maybe my aunt says the wrong things, or she's been visiting the hospital too many times because she's palliative, and for whatever reason, we get treated differently. And I just really want people to understand, those that are listening, that are patients or family members that aren't a part of the healthcare system, there are things that you can do. And I plead with you to complain, because you know what? It is we need to bring that iceberg right up to the surface. We have to let people know that there's a problem, and we can't let it keep going. We can't.
If you actually make a complaint to the hospital, don't think that it doesn't go anywhere because there are a lot of processes. There's patient engagement departments in a lot of hospitals.
Mhm.
They actually have to record your complaint and they have to follow up on it. So
Yes.
just because you feel like you've made this complaint, it's gone into thin air. Let's say you haven't heard back, follow up, follow up. Try to talk to somebody else. I mean, keep going because we really need to make our voices heard. And if you've had this experience, I guarantee you somebody else has had the same experience but probably
You
didn't
got it.
speak up. So you're
Mhm.
speaking on behalf of maybe 10, maybe 100 other people that either couldn't or wouldn't go to make this complaint. So I think we all have a responsibility to do this if we're in a position to do so. So what I mean by that is like you are able to voice your concerns, mentally you feel ready to tell your story because we know there's if you've been traumatized, it might be really difficult for you to do so. So I think if you can, I think it's really important that you follow up and voice your concerns and keep going until somebody listens.
Absolutely. Like, and you know what? If the hospital doesn't want to listen, there are lots of media stations out there that will be willing to listen to you. And the thing is, I think it's so important to tell these stories, because if we don't, nothing will change. And we can't keep checking boxes either. Like how many, we've read two cases, and how many of them have said, "Oh, they followed up with these various different protocols and changes in their policy or education." We know those things in terms of efficacy and how well they work. It still is a checkbox. There's so much more work. It's a culture. It's a whole culture shift that has to occur to see that type of change.
Hmm.
Sorry, I don't know if you finished your story. I'm so sorry. I totally went on
No,
a
you know what?
tangent.
The only follow up to that was that this fight took 2 years to resolve, and the privacy commissioner ruled that the patient could have footage if basic blurring was done. And because he showed no indication that he was going to reveal other people's faces. So the hospital ended up paying for the blurring and share the footage. After all that back and forth. That is
And the
all.
footage was devastating. Devastating. Like, I watched it and I was like, "Oh my god."
Like, how undignified would you feel? And apparently it took him 20 minutes to leave the hospital because that's how much pain he was in.
Oh
And
my
this
god.
person is just walking beside him. She's not helping him up. She's not getting him in a wheelchair. She's walking beside him. It appears that she's talking to him, but she's not offering any help. And other people are kind of like watching, but they're also not really stepping in either.
But I definitely wanted to talk about, I hope I'm going to say her name correctly, Joyce Equian. She's a mother of seven who died very soon after filming herself from the hospital bed um, a couple months ago, where she was in clear distress and pleading for help. Towards the end of the video, you do hear, which was streamed on Facebook Live, two female staff entering her room, hearing them making degrading comments, including calling her stupid, and one saying that she'd be better off dead. Uh, of course, the video created widespread indignation, and there were several inquiries and a lawsuit from the family against the hospital where she died in Quebec. But some people are saying, again, this is not a surprise. Like, this is not new behavior to Indigenous people and into it for Indigenous folks. I don't even know what to say, because I think this is where we talk about the, if we didn't have phones to record some of the injustices that we've been seeing over the past years, would people really believe how bad it actually was?
Right. So I think we talk about all the problems that come from having phones and social media, but in this case, it's really just, uncovering all the ugly things that happen in healthcare. And people might be shocked to hear this is happening, but if you work in the healthcare system, you shouldn't be that shocked because it happens way more often than you realize.
Well, this is why we continue to tell people, and we continue to say that there is racism in healthcare. There is systemic racism in healthcare, and we have to do something drastically different to address it. We can't just have people coming in as diversity, equity, inclusion agents to say, okay, I think that's a good step, but like, I think there's so much more work that has to be done, and it has to start right from the top. And I think, like, I hate the whole like zero, what did they call
Zero
it? Zero
tolerance.
tolerance policies. But I really think people, nurses, physicians, allied health, that are demonstrating like blatantly racist behavior towards patients and family members, they shouldn't have a job. I know that sounds harsh, but like,
Well,
I
I
don't
feel
want
like
a
that for a
racist
lot of
person looking
industries.
after me. Like, oh, absolutely. But in healthcare, it can prove to be deadly.
Absolutely.
And we can't have people like that in healthcare, but we know that we do, and we have to do something about it. So her husband kind of goes on to say that he's convinced his wife died because of systemic racism, and that there are a lot of issues plaguing in Quebec as well. Um, Again, I think the fact that she was able to capture this is a whole other piece, because they say, okay, you're not allowed to capture video footage or whatever in the hospital. Well, I'm sorry, if you're being racist, or I feel like my care is substandard, I might whip out my phone too. I know that sounds bad, but like, we have these phones and these devices for reasons. And I think that, like, what if, what if someone didn't tape George Floyd, or this or Joyce didn't tape what was happening, or Susan Moore didn't tape what was happening? We would never know the injustices that are continuing to happen day after day, related to race, ethnicity, social status, marginalization. It's so overwhelming.
Hmm. So let's talk about the $1 million question, or maybe it's $1 million discussion. What do you think? What are some small steps that we can all take to help improve this situation or educate ourselves about what's happening?
My first step is recognition. Organizations have to recognize that they have a problem. And I think that's the biggest pill to the and the hardest pill to swallow, to just say, we have a problem with systemic racism in healthcare, but we're going to combat it. And this is how we're going to do it. Like, the first step for me is to recognize it. What do you think? What do you think some of other things can be done?
Well, I mean, it's even like right now is Black History Month, right? So if we think about various different organizations, did they do anything for Black History Month? And if they did, was that to check a box? Do they talk
Oh,
about racism at any other time of the year, or is it only during February, which is Black History Month? So I
mhm.
think that's the thing we need to think about. It can't just be like a one off, it has to be something that's ingrained into culture. So it can't be like, oh, we want to be more diverse, so we're going to hire like this person because they're Black and they're going to be our token Black person or our token Asian person or our token Indigenous person. But having one person and not allowing them a seat at the table or really taking in what they're saying isn't going to solve any problems. So I think it just has to be
Yeah.
something that's sustainable. Like it can't be just a one off, and it can't be to check a box, or it can't be in response to something that's happened. And once you do your action items, that's it, and you pack it back away into a box.
Yeah, no, I wholeheartedly agree. I think the other thing I'd like to throw in there for patients and family is know your rights. Know that if you feel that you are, that your care is not very good, one, you should probably speak up and say, hey, this is how I'm feeling, this is what I am sensing. Because I think if you were to throw that out right off the hop, that might throw some people for a whirl. Of course, again, I know the biggest thing is people feel that, if they say something, that their care might even get worse, and
Right.
that's a problem in itself as well. Like, I mean, I think people should feel free to ask questions, and to be like, "Hey, I've been waiting for X amount of time. Like, what exactly is happening?" And for nurses, physicians to not be catty and snarky and be like, "Oh, there's other patients here, and it's super busy." Nobody wants to hear that when they're sick. Like, nobody, like, yeah, we understand it's busy, but you know what? I think this is where you talk about your hourly rounds, you talk about your good TOAs.
Transfer of accountability, in case people don't know what that stands for.
Oh, transfer of
Yeah.
accountability. Like, technically there's something called bedside rounds. Every hour someone should be at least checking in on you, whether that's like a, "Hey, how are you doing? Do you need something to drink? I'm here to give you your meds," whatever, and they do all of the care all at once. Or, so they do their hourly rounds, and they just check in on you, just say, "Hey, do you need a glass of water?" Because that is healthcare too, right? Don't forget that you're treating a human being. You're not treating a desk. You're not treating uh some obstinate or some piece of furniture. You're still dealing with a human being. And I think some people forget that in the busyness of their day, that you're dealing with someone who has feelings and emotions, and it's important to make sure that we take the time to treat people as such.
Right. And I think the thing is like if organizations aren't sure what to do, ask your patients. Have a
Mhm.
patient advisor. Ask them how they feel, their organization could improve, because it seems like a no-brainer, but often it's something that you actually have to do, and not just asking the same group of people you always talk to. You need to get different perspectives. You need to get right down to the front line and ask the people that are receiving the care how they think it can be improved. And it might be hard to hear all of the stories that they come forward with, but again, it's about recognizing that you have a problem and how can you move forward to address it.
Yeah, I actually really like that you threw that one in because that's really important. I think getting involved is another important aspect too. So like, yeah, maybe you had a really poor experience. You can actually reach out to the hospital and say, "Hey, I want to be a part of the solution because of this poor experience and I want to be able to be invited as a patient advisor to help form and shape policies and how things actually are operating in the hospital." I think that's another thing that a lot of people don't know that they can actually be a part of. So I'm glad that you brought that one up. Another thing
Mm-hmm.
that I would say is I we talk about education and we talk about training. We like those are, yes, they are a part of how we can combat anti-indigenous, anti-black racism, um, talking about marginalization and stigmatization related to mental health. Yes, yes, we could do education and training, but it needs to be starting within yourself. You need to check your own bias. Like, this is where you yourself as a human being as an individual need to be like, hey, do I have preconceived notions about people? Or do certain people come in and as soon as I read their chart about their care, something goes off in my head and I act a certain way or I do things differently in regards to these types of patients or these types of people? Or maybe you've had an experience where, let's say it was a negative one with a patient population or whatever. Am I taking that out on every single patient I now see? Or is there language? This is something we were talking about online. Is there language in the charts that continue to perpetuate this behavior, like frequent flyer,
Mm-hmm.
or
Drug seeking,
drug seeking, or like there's
or
so
like
many
difficult.
negative, difficult patient, like there's so many negative turns of phrases in medicine that we put in patients charts that we shouldn't be seeing anymore, and those things color the way that we act and behave towards our patients. So are you taking those things on as an individual and then perpetuating it? So again, check your own bias, do your homework. You're not going to learn about anti Black racism by sitting passively and someone's going to feed it to you. No, that's work you need to do as an individual. If you want to learn more about anti Indigenous or anti Black racism, you need to pick up a book and learn about it. There's so many great resources. I think we posted some last week that you can actually take an active role into how you can better understand and check your bias. So that's kind of my other piece.
Hmm. Yeah, and I just wanted to end with one last thing that I read last week, which really resonated with me, which is if you need to learn about racism, then consider yourself lucky because you haven't had to learn it by experiencing it every single day of your life.
Absolutely. I think this is one of the things that I'm sure not just myself but other people can appreciate is, I can't get out of the skin that I'm in, nor do I want to. But I can say that the skin that I'm in causes some people to think different about me, whereas some people in the skin that they're in, they don't have to deal with those types of situations. And it is racism.
Yeah,
But again, like I said, I love the skin that I'm in. It's awesome.
me too.
I wouldn't change it for the world.